Hi everyone, my name is Dr. J, and I am coming to you today just from my cell phone. I don't have any fancy podcasting equipment or microphones, so I hope you can hear me okay. I'm just a healthcare provider here in Southern California, and I've seen some things lately that have concerned me. So I just wanted to reach out and have a couple discussions with anybody who wants to listen about health problems or current conditions or, anything going on that might be of some benefit. What I've seen in my practice is that patients are waiting for months to be seen for routine problems or non-routine problems. They call and they try to get an appointment and they're not able to get in right away. And I think some of the things that patients want to come in and be seen for, you don't necessarily need to be seen for, but you don't know, and you won't know until you make that appointment and you come in and be seen. So, I thought maybe if we could just in general talk about certain conditions or things that go on in everyday life, that maybe you'll get some questions answered, or if not, that you'll have some information to have a informed discussion with your healthcare provider. And that's all I wanted to do. A lot of my patients can't get in to see me right away, and I try to get to as many of them as possible, but I suspect that a lot of people are having the same problem. So I thought maybe I would just release a video here and there about things that I'm seeing, because if one person is experiencing something, chances are a lot of other people are too. And hopefully I can answer some questions or just put your mind at ease, or like I said, give you information that you can then take to your provider and have a more informed discussion. As always, anything I talk about is just in general format. It is not meant to treat or diagnose anybody. It is just meant to provide you with the information you need to make decisions or to discuss with your healthcare provider. Okay, so let's talk about birth control. Seems to be a very hot topic right now. Hopefully this isn't something that's going away or that you will have difficulty getting in the future. But birth control currently is available, and for anyone not wanting to become pregnant, it is very useful. But birth control isn't just used to prevent pregnancy. And that kind of leads to another topic for women, abnormal bleeding. Women have monthly periods, and not everyone's period is the same. Some people have a period like clockwork every 28 days, but that's very rare. Anything from 24 to 36 days is normal. So when your provider asks you, do you have a period every month? We don't mean every 28 days. We mean sometime in that 24 to 36 day window, do you have a period? Okay, and most women bleed on average from 5 to 7 days. Some women less, some women more. Some women, their periods are light and easy, and some women, their periods are heavy and a nightmare. And I feel for you. I really do. So when it comes to controlling your periods, or when it comes to preventing pregnancy, we use the same thing. We use birth control. So there are a lot of different birth controls on the market right now, which is fantastic. There is the birth control pill that you take the same time every day. And I mean the same time every day. If you take it at 7 a.m. one day and 10 o'clock the next day and 12 noon the next day and 8 o'clock the following day, your birth control is not going to work for you, okay? Most birth control is about 99.3% effective in preventing pregnancy, as well as helping to manage your periods. If you don't take it as directed, it is not going to be as effective, and that's when you can end up pregnant, or you can start having some breakthrough or abnormal bleeding, okay? When it comes to the pill, there are two different kinds of birth control. There is combination birth control, which is estrogen and progesterone, and then there are progesterone only methods of birth control, and we'll get into those as well. For the progesterone only or the combination pill, same thing, take it the same time every day. What's the benefit? Some women cannot take estrogen, whether you have a history of high blood pressure or you've had a stroke or you smoke. Don't smoke and take estrogen. There's a lot of different reasons. Breast cancer. There's a lot of different reasons why you don't want to take estrogen or you cannot take estrogen. If you've recently had a baby and you're breastfeeding, again, you don't want to take estrogen. Estrogen can decrease your milk supply as well as transfer to your baby. Increases your risk of blood pressure elevation, increases your risk of developing a blood clot, having a stroke. On the other hand, estrogen is very beneficial to a lot of women as well, helping to manage your period, your menstrual cycle symptoms, acne, preventing or reducing the incidence of ovarian cysts, things like that. We will talk about ovarian cysts on another day. So in addition to the pill, as far as the combination methods, there is also the patch. The patch is a tiny little patch that fits on your skin. You can really put it anywhere on your body as long as it's not being rubbed by your clothes. You don't want anything to cause it to peel up, because then you're not going to get the full benefit. You wear the patch for 7 days and then you take it off, you put another one on, and you do that over the course of 3 weeks. On week 4, you take the patch off, you have a period. Kind of like with your pills and that placebo week. Okay, for combination methods, there's also the NuvaRing, which a lot of women really like. Instead of the patch where you take that off every day, or the pill that you have to take, the patch every week, and the pill that you take every day, the NuvaRing is a tiny little ring that a woman inserts into her vagina around her cervix, and that stays there for 3 weeks. You don't have to switch it out every week. It stays for 3 weeks. For week 4, you take that out, and again, you will have a period. Okay, now progesterone only. These are the methods that don't contain estrogen. So if you have a history of high blood pressure, if you smoke, if you've had a blood clot, if you have a personal history of breast cancer, those are some of the reasons why we would not want you to be on estrogen. If you are recently postpartum and breastfeeding, don't want you to have estrogen. So the progesterone only methods, like we've already said, the pill that you take the same time every day. There's also the Depo-Provera injection. This is an injection that goes into your arm, and it's good for 3 months. So you don't have to take a pill every day. You don't have to switch out a patch or a NuvaRing. The Depo-Provera shot is good for 3 months, so you get 4 shots per year, essentially 1 every 3 months. Just as effective in preventing pregnancy as the other methods we've already discussed. In addition to that, there is the Nexplanon device. That is a tiny little rod that actually goes under the skin of your arm, and that rod is good for 5 years. Most women who use progesterone-only methods, such as the Depo-Provera or the Nexplanon or the IUD, which we're going to discuss next, most women do not have periods. The reason for that is progesterone stops the lining of the uterus from forming. It's that lining that forms each month in preparation for childbirth. And if that lining doesn't form each month, there's nothing to shed. If there's nothing to shed, then there's no period. So most women, and I say most women because everybody reacts differently. Just like everyone's period is different, everybody reacts differently to medication. And so with the progesterone-only methods, most women don't have a period. Now those that do, it's usually something a panty liner could handle. It's usually better than what their average period was before. So we've talked about the Depo shot, we've talked about the Nexplanon device, which is the implant under the arm, and then lastly there is the intrauterine devices, or the IUDs. And those come in different time frames. There is a couple 3 years, like the Skyla or the Kylena. There's the Mirena, which by far is the most popular, and that one is actually good for 7 years. And then there is the non-hormonal copper IUD, the Paragard IUD. Now this birth control method contains no estrogen and no progesterone. Other than condoms, this is the only non-hormonal form of birth control. The Paragard IUD is great. It is good for 10 years. It is very effective in preventing pregnancy. Now, the difference with this one, the benefit, no hormones, things that we've already talked about, but because there are no hormones, it does not stop your period. So with the Paragard IUD, you will continue to have periods every month, Some women will report that their periods are heavier with the Paragard. Some women report spotting in between with the Paragard. Not everybody, okay? Other common side effects with progesterone. You will hear a lot of women say that they gained weight with the Depo-Provera shot, or specifically with the Depo-Provera shot, that they had issues with their bones. So the Depo-Provera shot can cause weight gain, and it does cause bone loss. Now that is reversible. We recommend being on the Depo-Provera shot for no longer than 3 years and then taking a break. Now any kind of depletion of calcium in your bones during that break will replenish itself. It is not irreversible, but we do want you to take a break from Depo. It is only the Depo shot. The Nexplanon, the pill, the IUDs, you don't need to do that. It doesn't cause the same reaction with your bones. Even though they're all progesterone, they're all slightly different in their chemical composition. So with the Depo, 3 years max, take a break, even 6 months, and then you can resume Depo if you want to. Make sure you're taking some vitamin D as well and calcium. Okay. Those are the forms of birth control, and again, those are to prevent pregnancy as well as to manage your periods. When it comes to the abnormal periods, when it comes to abnormal bleeding in general, we as providers are very limited with what we can do. There's basically 3 options, okay? And the first is do nothing. If your periods are heavy, if you're having spotting in between periods, in most situations, you don't have to treat that. If you're fine with it, then you can just observe it and not do anything. It can become bothersome, never knowing when you're going to bleed, never knowing if you need a change of clothes, and so then we do have options available, and we can try to manage it with medication, which is what we just talked about. Medication management of abnormal bleeding is to control those hormones, and we do that with hormones, so that would be the birth control. The third and final option would be surgical intervention, and depending on what's causing your bleeding, that may or may not be an option for you. But those are things that you would discuss with your healthcare provider. So I hope our discussion today about limited discussion about menstrual cycles, and more importantly birth control and in the use of preventing pregnancy as well as managing your cycles was useful to you. As I have other things come up in my day-to-day practice with patients that I see, that's where I'm going to generate these podcasts for, just to try to get those out to anybody else who may be experiencing the same issues or have the same questions. And again, everyone is different. There is no one way to treat or answer someone's questions for everybody. So these are not meant to treat or diagnose anyone who is listening. It is merely to provide you with information that will either help you in your situation or that you can use to have a discussion with your healthcare provider. I hope you found this information beneficial, and I look forward to seeing you again soon. Bye-bye.